The COLUMBA study is a phase 3 non-inferiority randomized trial conducted in relapsed and refractory myeloma patients in order to evaluate the efficacy and safety of DARA IV versus DARA subQ. Daratumumab is an anti-CD38 monoclonal antibody used in the treatment of patients with multiple myeloma and has demonstrated to be effective and safe. And it was given as intravenous administration, requiring quite long infusion times, 7 hours for the first infusion, 4 hours for the second infusion, and 3.5 hours for the third one and subsequent ones. In order to optimize the daratumumab administration, DARA subcutaneous was developed, in which DARA was co-formulated with recombinant hyaluronidase. And in fact, this new formulation was evaluated in a phase 1b study, showing that the DARA subQ was safe and effective, but the main finding is that according to the pharmacokinetic studies, it is possible to deliver it at flat dose, 1800 milligrams. And this was the rationale for the phase 3 randomized trial in which 522 relapsed and refractory myeloma patients were included and randomized 1-to-1 to receive DARA IV versus DARA subQ. The scheme of administration was exactly the same in both arms, DARA weekly during the first 2 cycles, every other week during cycles 3 to 6, and just monthly since the cycle number 7. But the difference is that the control arm included the administration of DARA IV at a dose of 16 milligrams per kilo, whilst the experimental arm included the administration of DARA subQ flat dose 1800 milligrams. The co-primary endpoints in order to demonstrate that DARA subQ was not inferior to DARA IV were to evaluate the overall response rate and the maximum concentration through evaluated at cycle 3, day 1. In terms of overall response rate, the overall response rate for DARA IV was 37% and for DARA subQ was 41%. Slightly higher, but the relative risk was 1.1, and according to the specified criteria, DARA subQ is not inferior to DARA IV. And in fact, this relative risk, this overall response rate was maintained across the different subgroup of patients. And I think that one important subgroup of patients was according to the body weight. And patients with body weight lower than 65, between 65 and 85, and especially patients higher than 85 had a similar overall response rate. The second co-primary endpoint was the maximum concentration through evaluated at cycle 3, day 1, and the mean geometric concentration for DARA subQ versus DARA IV were also comparable. Well, this means that DARA subQ was not inferior to DARA IV, and another endpoints were evaluated. PFS and overall survival also comparable in both arms. The PFS is approximately 5-6 months, comparable to the median PFS so far reported with DARA single agent in similar patients population. But additional important advantage for DARA subQ is the time of infusion. I previously said that DARA IV required the long infusion times, 7, 4, and 3 hours for the first, second, and third and subsequent infusion respectively, whilst the DARA subQ is delivered since the first infusion in only 5 minutes. In addition, in terms of safety profile, infusion-related reactions occurred less frequently for DARA subQ in comparison with the DARA IV. And in fact, only 13% of patients receiving DARA subQ experienced any type of reaction, whilst 35% of patients who received DARA IV. Most infusion-related reactions were of grade 1 and 2, but I think that this is also an important advantage. No significant differences in terms of hematological or non-hematological adverse events, but I think it's also important to note that a questionnaire was evaluating the patient satisfaction, and it was much more great and evident for DARA subQ versus DARA IV. So I think that this is the summary of the study, and I would say that DARA subQ can be used in every patient with multiple myeloma, in which when we plan to use daratumumab, single agent or in combination with different backbones, due to the non-inferiority in terms of overall response rate and maximum concentration through, and especially due to the advantages in terms of time of infusion as well as infusion-related reactions. I think that this study has a great impact in the patient care, especially because daratumumab is taking part of the different lines of therapy that we use for the management of our patients with multiple myeloma. And I would say that almost all myeloma patients will receive daratumumab at any time of the disease. The possibility of using a subcutaneous formulation is much more convenient for the patients, because the time required to be at the hospital is going to be significantly reduced in comparison with the IV administration. And in addition, the probability of having any type of infusion-related reaction is significantly reduced. So if we put together safety profile with convenience, considering that efficacy is similar to the DARA IV, I think that the use of DARA subQ is going to have a great impact in the patient care.